Hello guys, welcome back to my channel which is Real Homeopathy. Please do like, share and subscribe to my channel, and for more updates press the bell icon and stay tuned for all of my upcoming videos. And today I'll be explaining you all about the comparative study of these three basic miasms which I have previously explained in the before class, which is on miasms itself. That was a part 1 and this is the part 2 of that, and today I'll be saying you about its basic symptoms of that. So first you will see vertigo. Vertigo we will see in how it will be there in psora, syphilis and psychosis. What type of vertigo we will see. So the symptom will be vertigo. In psora you'll see vertigo from digestive disturbances, you'll see, and these will be aggravated by emotional disturbances, which is aggravated by walking, motion of any kind, and it is ameliorated by lying down. So vertigo from digestive disturbances, which is aggravated emotional. Aggravation is walking, emotional and motion of any kind. Amelioration, rest. And coming to psychosis, vertigo on closing the eyes and disappears on opening the eyes. Coming to syphilis, vertigo begins at the base of the brain and it is accompanied by the forgetfulness. Very peculiar symptom is forgetfulness. So the vertigo is accompanied by forgetfulness, which comes under the syphilis here. Next, first was the vertigo, and next we will see about the headache here. Psora, headache will be in the temporal and the parietal sides. Psychosis will be in the parietal, and syphilis will be in the occipital region. So here psora, there is throbbing headache with red face, flushed face, and congestive headache here. Usually it is frontal and parietal. Headache will be on the frontal and the parietal sides here, and which is ameliorated by rest, lying down, heat and warm application. Next, coming to how headache will be in psychosis. Headache in the vertex, which is aggravated at night, especially the midnight. Headache ameliorated by motion. Okay, amelioration is by motion, especially the headache will be more in the midnight. Coming to syphilis, generally in the back of the head, which is occipital region, which is aggravated during night, which is dull, heavy headache, ameliorated by motion. Aggravated by heat or warmth application, child bores the head into the pillow. Next, coming to the head and hair of these three miasms, how it will be there. So in psora, how the hair will be there, psychosis and syphilis we will see. So the psora will be premature graying of hair. You'll see it in psora. There are split ends with hair fall of single hairs. And in psychosis you'll see hair falls in circular spots. Syphilis, hair moist, it is greasy with offensive odor, hair fall in bunches from beard, eyelashes and eyebrows. And head will be open, fontanelle is generally hydrocephalloid appearance of the head. In psychosis you'll see perspiration will be present in the scalp. Okay, and in syphilis the scalp will be moist. In psora there is dirty scalp. Okay, premature graying of hair. So about the headache. And coming to eyes, psora, psychosis and syphilis. In psora you will see the eyes will be like intolerance to daylight or sunlight. There will be aggravation to everything which is in general. In psora case, psora is the beginning of all the diseases. It is the mother, it is the hydra headed. So psora, as we have discussed what is psora, psychosis and syphilis in the previous class, today we will be regarding the symptoms of those miasms. So psora, you will see here intolerance to daylight or sunlight. Basic miasm is psora. Next will be psychosis. You will see optic neuralgia aggravated by change of weather. Syphilis, intolerance of artificial light, ptosis, which is drooping of the eyelids. Corneal ulcers will be there. Greenish or greenish yellow discharges will be there from the eyes. That comes under syphilis. And discharges will comes under the syphilis here. Next, coming to ears. Ears on psora, psychosis and syphilis you will see. In ears, psora, loss of moisture in ear. Dry, scaly auditory canal. Oversensitive to noises. That all comes under the psora. Loss of moisture in ear. Dry, scaly, psora. Psychosis, you'll see acute otitis media with profuse exudation, incoordination in the sense of hearing, causes him to hear best in noise. Causes him to hear best in the noise. Okay. Next, coming to syphilis, troubles of the middle ear discharges, which is related the symptoms, and the symptoms occur when the discharge is suppressed. The discharge is suppressed, then the symptoms will occur here. Ameliorate the symptoms, and symptoms occur when the discharge is suppressed. So it is a reverse. Patient will feel better when the symptoms are there, and the disease will be suppressed by this discharges. So this is all related to syphilis. Next, coming to the face of this miasms, who can differentiate it. So in sora, you will see shape of an inverted triangle. Okay, inverted triangle comes under the sora. Feverish face, red and shiny, presence of acne and pimples, unwashed appearance of face, very dirty kind of face, very dry face, a triangle kind of inverted triangle face, red and shiny, flushed face. Next, coming to psychosis, you'll see there is blue and cyanotic face due to venous congestion, any respiratory illnesses, all of that comes under the psychosis here. Any pathological, any functional changes will be there, that all comes under the psychosis. Only functional changes will come under the sora. Psychosis, what will happen? There is any structural changes, that is bluish and cyanotic face due to venous congestion. Next, come to syphilis, there is grayish, greasy face, deep fissures, especially in the lips, comes to syphilis. Next, nose. In nose, you'll see in sora, psychosis and syphilis. So in sora, you'll see nose, it is oversensitive to odors, faints with smell of perfumes. The person will get aggravation to the perfumes, not much offensive discharges. Next, you'll see psychosis, sense of smell is lost. Sense of smell is lost, and snuffles in children. And in syphilis, you'll see sense of smell is lost, easy tendency of bleeding nose, epistaxis comes to syphilis. Syphilitic remedy will come for epistaxis. This is a general ideas that you get from this differentiation here. And in psychosis, you'll see discharges with characteristic fish brine odor. That will come under the psychosis, fish brine kind of odor here. Next, mouth, sora mouth, psychosis and syphilis, how it will be there. Mouth of the sora patient, you will see there is oral thrush and stomatitis, okay, which are ulcers. And psychosis, you will see leukoplakia. Here leukoplakia, that is a psychosis. You will see the picture has been displayed here in psychosis. So leukoplakia. Next, coming to oral ulcers with decay of tooth. Oral ulcers with decay of tooth will come under the syphilis here. Nextly, you will see taste of the sora patient, burnt kind of taste. Psychosis, fishy taste. Syphilis, metallic taste. So based on the taste of the patient's symptoms, you can identify which miasm the patient is. Next, coming to cravings of each of those miasms here. So sora, syphilis and psychosis. So what is the craving of sora here? Cravings and hunger, which is appetite. Sora, he is always hungry. Craves sweets, acids, sour foods. Craves for indigestible things and aversion to sweets during fever. Prefers hot food. Sora is the hot this thing, and so it prefers hot food here. Psychosis, you will see craves for beer. Psychosis prefers either cold or hot, both ambithermal. Syphilis, you will see craves chalk, lime, pencils, acids and sweets. And here the patient prefers cold foods. Sora, you will see always hungry but craves sweets, acids and sour foods. Syphilis, psychosis, the patient in psychosis will crave for beer, and in syphilis the patient will crave for chalks, limes, pencil, acids and sweets. Next, the cough of these patients. In sora, the cough and expectoration will be dry, teasing cough. Psychosis, bronchial cough. Syphilis, barking cough. In sora, salty or sweetest expectoration will be there, and in psychosis you will see less expectoration though there is a large accumulation, but there will be less expectoration. So this comes under psychosis, which is a bronchial cough. Syphilis, which is a barking cough, greenish yellow, offensive, salty expectoration will be there. Greenish, yellow, offensive, salty expectoration. Salty, yellow, smell is offensive. That comes under the syphilis here. Coming to heart symptoms of SORA, so sensation of band in the heart, anxiety and fear of death. Symptoms severe but risk is less. In psychosis, you'll see chest pain and breathlessness, dyspnea, aggravated by slight exercise. Die suddenly without any warning. That is psychosis. Coming to syphilis, you'll see occasional slight pains and dyspnea, but die suddenly without any warning here. Same like that of psychosis, die suddenly without any warning. But here in psychosis, you'll see there is chest pain, breathlessness, and syphilis, there will be occasional pains, but dyspnea will be there. SORA, sensation of something band has been tied around the heart. There is anxiety and there is fear of death here with less risk. Next, in abdominal symptoms of SORA, you'll see sensation of fullness immediately after eating. The patient feels full. That is immediately fullness. Abdominal pains, sore, which is and bruised and pulsating pain, which is ameliorated by heat. Psychosis, stitching, pulsating pain. Syphilis, burning, bruising and tearing pain. That is all the differences you'll get to know on pain. Stitching, pulsating pain will come in psychosis. Bruised and sore pulsating will come in SORA. Syphilis, you will see burning, bruising and tearing sensation in syphilis. Next, coming to abdominal symptoms, that is diarrhea. In SORA, the diarrhea symptoms will be like spasms, offensive, painless diarrhea. So there is spasms and painless. How? There is spasm, but the patient don't feel any pain. Ailments from overeating. In psychosis, you'll see stools are sour, grass green in color with abdominal colic. In syphilis, you'll see slimy, bloody with offensive smell. Constipation in SORA passes small, hard, difficult stools. Alterations of constipation and diarrhea both are present in the SORA. But in psychosis, how constipation will be there, I'll say. There will be constipation with stitching and pulsating pain. Syphilis, prolonged constipation, which is associated with the headache. Very peculiarity of this syphilis here. Coming to the constipation of SORA, passes small, hard, difficult stools, alternation with the constipation and diarrhea both. This is based on the abdominal symptoms. Next, coming to urinary symptoms in SORA, involuntary urination while coughing, sneezing and laughing. Purely SORA. Involuntary urination while coughing, sneezing and laughing. There is smarting and burning on urination. Psychosis, there is intense pain on urination. Syphilis, there is nocturnal enuresis. Night times, urination on the bed itself. That comes under the syphilis here. Nextly, female complaints in SORA, there is only functional abnormalities like that of amenorrhea and dysmenorrhea. Without any pathological cause, there is this symptoms here appearing. Absence of menses, painful menses comes under the SORA. Coming to psychosis, you'll see all inflammatory diseases involving the pelvic organs. Okay, syphilis, you'll see cervical and vulval erosions with ulcerations. Structural changes, pathological occurrences comes under the syphilis here. Nextly, ulcers, you'll see there are deep cracked ulcers, superficially cracked ulcers. I'll say you about the ulcers here. SORA, psychosis and syphilis. Next, you'll see in SORA how the ulcers will be there. So in SORA, each appears before, the skin looks dirty and the ulcer looks dirty and unwashed here in the psora. Psora patient is always dry and dirty, the face is hot and flushed, it is very dry. In psychosis, you'll see the ulcer infiltrates and is corroded by its discharges. Certain discharges will come from the ulcers. In syphilis, you'll see ulcerates and the bony structure is changed. Directly, the organ damage. Coming to biles. In boils, you'll see the psora, psychosis, and syphilis. This boils, and in psora, you'll see simple boils. Psychosis boils with excessive pus. Syphilis boils with increased tendency to bleed. Psora, you'll see simple boils. Boils with excessive pus. Psychosis. Boils with increased tendency to bleeding. Syphilis, bleeding. Psychosis is pus. Psora is simple boils, plain boils. In psora, you'll see there is itching is always associated. Main symptom of psora is itch. Psychosis, there is soreness with crust formation. I have said you there is a crust formation. Psychosis. Next, in syphilis, you'll see there is shedding of scales and crust with internal raw surface. There is shedding of crust with internal sore and internal sore crust with inner raw surface. There will be shedding of the skin here. So, looking miasms in the face. By seeing the face, you have to understand what is the miasm of the patient here. So this was all about the miasm, the boils and the psora, ulcers. You have seen the abdominal complaints, urinary complaints, female complaints, okay, urinary complaints, abdominal complaints, heart symptoms, cough. You have seen about 3 of the miasms, and you have seen about the cravings of those, and you have seen about how the mouth will be there, its nose, its face, ears, eyes, head and hair, headache of the patient, and vertigo. So this was it. So this is all about the basic 3 basic miasms, which is psora, psychosis and syphilis. And today I want to end this class with a comparative study on miasms, and that was it for today. And I just want to thank you all for supporting me till today, and I just want you all to keep supporting me and press the bell icon below, and for more updates stay tuned.